Now, live with Greg Olsen, Director of the New York State Office for the Aging.
Well, hi, everybody, and thanks for joining us. This is Greg Olsen, Director of the New York State Office for Aging, and I am again, for the third time, really excited to have back with me Fred Riccardi from the Medicare Rights Center and our own Heather Leddick, who runs our Health Insurance Information Counseling and Assistance Program. You know, we've been trying to set this up now for a couple of months to get really to this day, which is to talk about the Medicare Savings Program and the benefits that it can have to you. As you know, the pandemic made the economics of really everybody, but particularly older adults, that much more difficult. We've seen inflation in, home heating costs and raw food costs and gas and a lot of other areas. And for those individuals who are lower income or on fixed incomes, that really can take a devastating toll. This is an opportunity here with this program today to learn how to actually put cash back in your pockets. So let me formally introduce our two guests again. And I, again, thank you too for taking the time now for the third time in 3 months. But this is really, really important. I'm going to start with Fred from the Medicare Rights Center. Fred serves as the president of the Medicare Rights Center. As vice president for client service, Fred oversaw all of the Medicare Rights clients programming, including its national helpline, which handles around 20,000 questions each year, and developed and implemented a variety of successful programs with diverse partners, including 2 new ombudsman programs for New Yorkers with specific healthcare needs. He is a lecturer of Columbia University School of Social Work. He's a frequent spokesman, really both in New York and nationwide on Medicare issues, is a wonderful partner to us and provides great service, him and his staff in New York State. So Fred, thanks for joining us today.
Thank you, Greg. I'm happy to be here and to talk about one of my favorite topics. Thank you.
Wonderful. And our very own Heather Leddick. She's the program coordinator with the Health Insurance Information Counseling and Assistance Program. And you don't have to remember that. We call that HIICAP here in New York State. Heather has over 20 years of experience developing policy and program materials to support state and local management of aging services. In her current role, Heather provides detailed case assistance to New York beneficiaries and our 59 local HIICAP programs who seek Medicare assistance. She assists with the review and approval of federal program applications and modifications while providing ongoing technical assistance and monitoring to make sure that our program requirements are met. She has a long history prior to coming here and working for aging as an aging service specialist for Rensselaer County. She also ran and coordinated their New York Connects program, National Family Caregiver Support Program, and their HIICAP program. And she has a Bachelor's of Science from the Empire State College. So Heather, welcome back to you as well. And thanks for joining us.
Thanks, Greg. Happy to be here.
So before we dive into the questions, we're going to tee up and take a little break here. So check this out.
The Medicare Savings Program, or MSP, could save you up to $7,000 annually. Hi, I'm Heather Leddick with New York's Health Insurance Information Counseling and Assistance Program, also known as HIICAP here at the New York State Office for the Aging. New York State recently expanded the MSP to include higher income limits in 2023. What does this mean? You and approximately 300,000 other New Yorkers may be newly eligible for this assistance right now. If your income falls within the levels on your screen, please apply today. If your income is just above these numbers, still consider applying. You may be paying for out-of-pocket costs that can be deducted from your gross income to make you eligible. Free, objective, statewide assistance is also available to help you in the application process through HIICAP. Simply call the statewide helpline at 1-800-701-0501. Here's a bit more information. The MSP helps pay out-of-pocket Medicare costs such as your Part B premium. To be eligible, you must already be a Medicare beneficiary, meet the income requirements, and apply for this assistance. Once approved, reimbursement will come through your Social Security check. You can print an application online, and you can also pick up an application through your local HIICAP program. It's a simple front and back application, but you'll need to gather some documentation. You'll need photocopies of your Medicare card, proof of income, documentation about health insurance premiums you pay other than your Medicare premiums, proof of your date of birth, and proof of residency. Income information can include your Social Security, award letter, your monthly pension statement, or any other earned income such as pay stubs. Please refer to page 2 of the application form for more detailed information about documentation. As we mentioned earlier, help with the application is available through HIICAP. HIICAP offers free, objective, and statewide assistance. To apply for the Medicare Savings Program, simply call HIICAP at 1-800-701-0501. Callers will be routed to their local program for assistance. From there, you can schedule an appointment to meet with a counselor. You'll need to bring some of the documentation outlined earlier in this video. Don't miss this opportunity to save on your out-of-pocket healthcare costs today.
Well, that's great, Heather. Thanks for teeing that up for us. That's exactly what we're going to talk about. We're going to do a little bit more of a deeper dive so folks out there can really understand the mechanics of this. If you have questions and you put them into the chat box, we will have a Q&A period at the end. So make sure that you stick with us so that when we're done, we can answer any questions that you may have. So let me start with whoever wants to take this first question and just tell me, what is the Medicare Savings Program, MSP?
Thanks, Greg. I'll grab that. So the Medicare Savings Program is for individuals with limited income, and we're going to hear a little bit more about those income guidelines coming up. But it's going to help reimburse them their Medicare Part B premiums and also save them some money on other Medicare health-related costs. So really, to make it as simple as possible, the Medicare Part B premium is currently $164.90. So individuals get that deducted out of their Social Security check. And if income eligible for the Medicare Savings Program, you get that reimbursed back into your Social Security check. So the goal of the program, again, is to help save money, and you might be eligible to save up to $7,000 annually.
I mean, again, that's a substantial amount of money. That's almost $600 a month extra. Where did the MSP program or Medicare Savings Program come from, and why do we have it?
So Greg, I can take that. So this is a federal program, but it's administered by the states. And the goal of the program was to help older adults and people with disabilities on Medicare better afford their coverage, especially during these times where the cost of daily living have been rising. We are so grateful for Governor Hochul and the New York State Legislature to have expanded this benefit this year. And so the reason that we are continuing to talk about it is because we want everyone to consider getting screened for this benefit and to not count themselves out, because it's extremely important and it can pay for people's direct healthcare costs.
Yeah, and I'm glad you said that. The governor's leadership and the negotiation with the legislature, this is really a big deal. I don't know anybody in any walk of life that wouldn't take an extra $600 a month, regardless of what age we are or what our income levels are. So, Fred, MSP's been around a while. Why might people not have heard about this benefit before?
Well, the reason is, first of all, many people find Medicare very confusing. And we know on average, if you are watching TV, if you're answering the phone, you're getting inundated with information about Medicare and insurance options, and it can be really confusing. And so sometimes when we talk about the Medicare Savings Program, people confuse it with switching their Medicare coverage, and it's not that at all. What it is a benefit to help people pay for their Medicare, and it doesn't change the way that you receive your Medicare, whether you're in a private plan or original Medicare. It's really just to help pay your monthly Medicare premium that all Medicare beneficiaries pay. that $164 a month. And also it helps lower the cost of your prescription drugs. And so we're on a campaign to get this information out there that more people are eligible. We think over 300,000 people in New York State are newly eligible for this benefit.
Yeah, and I was going to ask you, and I see Alex has graciously put the income limits on the bottom. So there's not only potentially over 300,000 new people eligible, but there's probably lots of people out there that don't know about this, that were eligible under the older guidelines as well as the new guidelines. So, just for a verbal, in case folks did not see that tag, can you go through again what the income limits are and really reiterate what Heather talked about out-of-pocket expenses? If your income is just above here, it's still worthwhile.
Yep. And that's why I love to use round numbers. So if you are a single person, you can have income up and around $2,300 a month. But even if your income is over that limit, you may still qualify because there's some healthcare expenses that can be deducted from that eligibility limit. And if you're in a couple, your income can be around $3,100 a month. And again, even if your income is above that, we encourage you to be screened for the benefit because you may still qualify. And one important thing I want to add, we know more and more, many older adults are continuing to work. And so if you're working, your income can be much higher than those income limits, and you could still qualify for the Medicare Savings Program. So being screened is really easy. You can call the HIICAP, you can call the Medicare Right Center. We will ask you some very simple questions and tell you whether or not we think you're going to be eligible for this benefit. And the one thing I want to add is we know that nearly 100,000 people in 2023 alone have accessed this benefit, and we still have hundreds of thousands more people out there. So we're going to continue to message around this.
Yeah, and you had mentioned if you're still working, you're also paying health insurance premiums probably at work, I'm sure. Are those types of things deductible as well?
Yep, health insurance premiums, as if employer coverage premiums. If you have something that's called a Medigap or a supplemental policy, that can be deducted. Maybe you're paying for a separate dental policy, that can be deducted also from your accountable income.
Yeah, and that's really helpful just for folks not to just make an assumption if your income's a little bit higher to bail on this. There's no harm and no foul. And as you said, getting screened because you may get the benefit. Now, you talk about the up to $7,000. So is that more a fixed amount that most people could expect, or is it kind of a range and based on several factors, income and out-of-pocket costs?
So it's more of an average. We know that everyone who enrolls in the Medicare Savings Program at minimum will get that Part B premium reimbursement put directly back into their Social Security check. That's the average of $165 a month. But that $7,000 annual average, it can be much more than that. For example, I just spoke to someone last week who's new to Medicare, has a number of conditions. Rheumatoid arthritis is one of those. And so we all know that those prescription drugs are very expensive. So for someone to enroll in the Medicare Savings Program, they would end up saving thousands of dollars more because it would pay for those costly drugs. Because enrolling in the Medicare Savings Program automatically lowers the cost of your Medicare Part D prescription drugs.
Yeah, I mean, it's really important. We're going to take a quick break and we'll come back to Fred and Heather to learn a little bit more about New York State's, and I believe one of the largest aging state conferences in the country. Stay with us.
Hi, everyone. It's Becky Prevey from the Association on Aging in New York, a membership organization that represents the 59 offices for the aging throughout the state and our over 1,300 partners and subcontractors that deliver aging services throughout our great state. We are absolutely thrilled to once again this year be hosting the Aging Concerns Unite Us conference, which will be held at the beautiful Desmond Hotel in Albany, New York. We are also super excited this year to be laser focused on the Master Plan on Aging and the recently signed executive order by Governor Hochul to ensure that all state agencies and partners are working together to make New York an age-friendly state. We are thrilled this year to be hosting a variety of subject matter experts that are willing to share their talents and their knowledge with the Aging Services Network. We once again are hoping to have over 500 in-person attendees at this year's Aging Concerns Unite Us conference, with a virtual option for those individuals that are not able to attend in person. On behalf of the Association on Aging in New York and our wonderful board of directors and the New York State Office for the Aging, we are very hopeful you will be able to join us for this wonderful conference that brings together a variety of subject matter experts. Thank you.
That's great. And I love the virtual option. And New York State is an awfully big state, and it's hard for people to travel sometimes 4, 5, 6 hours. So, we'll have 500 people in person and hopefully hundreds and hundreds of more that can join virtually. So Heather, I'm going to jump back to you. We kind of got the lay of the land, right? We know the income limits. We know, some things that people can do to reduce that, how much money potentially you can save, really the value of this for people. In any circumstance, the economics of this are really important. But the key question now is, well, how do I apply?
Right. How do you apply? So you can apply and, you can download an application off of the Department of Health's website. But really what I want to point out today and touch on is the easiest way to apply for the program is through HIICAP, the Health Insurance Information Counseling and Assistance Program. So how do you reach us? It's our number right on the screen, 1-800-701-0501. We have over 700 trained counselors across the state at the ready to assist folks in applying for this Medicare Savings Program. And Fred mentioned earlier some information about if you're just above the income guidelines. There's some disregards that we could use to help somebody get qualified. It can be very overwhelming. It could be very complicated. So we encourage you to come to us, and we are the trusted, free, objective source to provide you that information and to help beneficiaries apply for the program. So again, HIICAP 1-800-701-0501. That's how you can reach somebody at your local level there to help you with the application.
Yeah, and I think we shared also, Fred's organization's information as well. Look, people are different. Not everybody is comfortable picking up the phone, asking for help. They may try to do this on their own, and that's fine. But I just want the public to know, both with Fred's organization, his staff, with Heather, our staff here, and all of our folks around the state, that all of our counselors are state certified. They're not selling you anything. They're there to provide assistance to you if you need help in applying. So if you want to go it alone, that's perfectly fine. But if you're having trouble with a particular part of it or don't understand a question, pick up the phone or stop into to our HIICAP locations to get the help that you need. It's a really, really important benefit. And I just want to reiterate, it's free and it's objective, and we're really here to help you. What information or paperwork do people need to bring when they're working with a HIICAP counselor, or Fred, if they're working with your folks as well, regarding MSP, to verify some of the things that need to be verified?
Yeah, so I mentioned before, it's a very simple front and back application. And what accompanies the application is copies of things like proof of income, proof of residency, proof of date of birth with your driver's license or another form, and proof of income, if I did not mention that already. And of course, your Medicare card would need to accompany it as well. So that would be copies of that would need to be brought to the HIICAP counseling session. And there the counselor can help you put that all together and then get that sent off to the agency that processes the Medicare Savings Program applications.
So there's some things you apply for where you might need multiple things. So when you say, I'm going to ask you for 2 examples. Proof of residency. Could that be a letter with my name on it from the phone company, for example?
Yes.
Okay. Mm-hmm. So, and is it just one thing, right?
Yeah, it's just one thing, and it can be something as simple as a utility bill with your name and your address on it to prove residency.
And proof of income can be paycheck stubs. What else?
Typically, it's the Social Security Award letter, copy of any pensions that you might receive. And if you're wondering, oh, what's a Social Security Award letter? Where do I get that? And you should be mailed that every year by Social Security, but you can also create a My Social Security account and you can download it that way. And it would be a copy of your Social Security Award letter, your pension, any income that you receive on a monthly basis would need to be sent in with the application.
That's great. Okay, so I viewed this. I fit within the income. I called you guys and I got screened. I became eligible. I'm super excited. Well, now what happens? How do I know if I actually got enrolled? How do I know? Do I get a confirmation? Do they send me a check in the mail? How does the reimbursement get done? So, I'm so excited because I did it. Now what?
Yeah. So great question, Greg. There's a few things that will happen. Once the application is submitted, and keep in mind, it can be mailed in to your local Department of Social Services. It can be dropped off. I always recommend to keep a copy of whatever's submitted, just in case you have to track that application at a later point. And then you wait about 45 days, sometimes more, sometimes depending how busy the local Department of Social Services is, it could take over 60, even 90 days to get that response. But you will get a letter in the mail, both from your local county Department of Social Services, and you will also get a separate letter from Social Security that will be very clear whether or not you've been approved for the program and when you can expect that reimbursement. And so for some individuals who qualify on the income level that's slightly higher, you will get that Part B premium put back into your Social Security check. You will see that on your bank statement. You will see a higher reimbursement from Social Security. And sometimes you may even get 3 months of a retroactive reimbursement of that Part B premium. So if you've applied and on May 1st, that application is submitted, you may have to wait a couple months. And then if you're approved, you will get 3 months of that Part B premium reimbursed. And generally people are really, really happy when they see that bump in their Social Security check and also that additional amount in their checking account from Social Security.
I think that's absolutely huge. So the day that I enroll starts the clock. It might take some time to process, but it's that day of the enrollment. I think that's fantastic. So that might have been that. Oh, did you have something, Heather?
Sorry, Greg. I just wanted to mention that I wanted to just share a story so people can understand the value of it. So several months ago, I was talking to a local couple here in the Albany area, and they were not eligible, right? They weren't eligible for the MSP. And I said, hold tight, wait till this expansion comes out and let's talk again. So we did, and I helped them apply for the program. And just another little tip I want to mention is if people are going to go it alone and print the application out, it needs to be printed on legal size paper. I just want to mention that because some folks don't, and it needs to be printed on legal size paper. But I helped the couple apply. They were actually $3 under the new expanded income levels. And they called the other day and they got a big, they got their reimbursement. They got 3 months retroactive and they were so happy. And it was a really great success story. And it really highlights how that expanded income from the Medicare Savings Program is helping folks.
And I love stories like that. So for the audience, this is what Heather and Fred and their staff and our network does every single day. And it just gives me chills hearing about it. So that might have been the easy part of the program. I think Fred said about 100,000 people have signed up. That means 200,000 plus have not. So let's take some of your questions and hopefully you'll go through the screening process as well and get enrolled in the MSP. So the first question, do Social Security benefits count as income?
Yes, they do.
Great question. How about if you have money in a 401k? Does this affect, I'm assuming the question is, does it affect does the money in the 401k affect the application for MSP?
Great question. There is no resource limit in New York State to qualify for this benefit. So for people who have saved money and have worked their entire life, you can still qualify for this benefit, even though you have money in your 401k. If you're taking your required minimum distribution from your 401k, that's your RMD, that is counted as income. But that amount is always much smaller than the large amount that you have in your 401k. But that's a great question.
Darlene, thanks for that question. That was really important to bring up the lack of a resource list. I don't have coverage for dental, vision, or medicine. Would this help with expenses for those?
Yeah, so it's going to help offset those Part D medicine prescription drug costs. So my recommendation, Carol, great question, is to reach out to HIICAP and give one of our counselors a call, and they can go through all of this with you to ensure that, you know, you apply for the Medicare Savings Program if income eligible, and then you receive the prescription drug assistance that you need as well.
Yeah, and certainly if you do qualify and you wind up with an extra $7,000, the program itself can reduce prescription costs, but then you'd have a little additional money in your pocket. We know how expensive dental and vision care is across this country. Thank you for that question. Are these forms available at the Social Security Administration office? Good question.
No, they are not available at the Social Security Administration. The Medicare Savings Program application is available through the Department of Health's website, and we also have it available through our website as well.
For the couple requirement, do both have to be on Medicare? If only one is, then does the single requirement apply? Good question. So if I'm on Medicare, but my spouse isn't, do I apply as a single?
You would apply as a couple. In most cases, if you're married and living together, then the eligibility limit applies as a married couple. Do you agree, Heather?
Yeah, so do they both have to be on Medicare? Yeah, there's a little bit of a formula when we determine household size, married couple, and also there's some particulars when it comes to budgeting for the earned income versus unearned, which we don't want to get into all of that today. The best and easiest thing to do is to reach out and call the number and be routed to one of your local HIICAP coordinators, and they'll be able to help you navigate all of that.
Great, thanks. Good question. We have any others? Yep. Are you allowed to include medical insurance in the application?
Absolutely. So if you are paying for certain types of insurance, like a supplemental policy that pays secondary to Medicare, if you have retiree insurance that you're paying a monthly premium for, if you're still working and have some employer coverage, that can help you qualify.
So those are
premiums too.
So those are all the disregards that you and Heather have been talking about. If you're paying those things out of pocket, they will reduce your income and potentially qualify you.
Yep, it reduces the amount of income that they'll count towards your application.
Great. Karen, thank you for sharing this webinar on your Facebook page. We encourage everybody to do that. There are hundreds of thousands of people that can really benefit from that. So thank you so much, Karen. Here's a question. I elected a MAP plan this year. Am I still eligible if I meet the income requirements?
So if you're enrolled in a Medicare Advantage plan, you can still qualify for this benefit. You will have your Part B premium reimbursed. If you're paying for prescription drugs, you will receive lower co-payments for any prescription drugs that you're picking up at the pharmacy. So you still qualify. No matter what way you qualify and access your Medicare coverage, you can still enroll in this benefit.
I have mobility issues. Can you apply over the phone?
Well, what we can do is mail you an application, and then we can hop on the phone and we can help you complete the application and walk you through it step by step.
Outstanding.
Absolutely.
Great. Does VA disability payments count as income?
Yes, any income from the Veterans Administration would be considered countable income.
Thanks, Connie, for that question. what is the maximum Social Security income to qualify for MSP? And then it says PKS.
Maybe perks. I think so. When you say what is the maximum Social Security income, we're looking at really what is the threshold there for the MSP income, and it was $3,077 a month. So if you're at that or below, we would encourage you to reach out and be screened for the Medicare Savings Program, and that would include your monthly Social Security income. So that and any other form of income you're receiving would go into that $3,077 number for eligibility.
Great. Okay. Well, we're getting a lot of thank yous. You're all very welcome. Please share this on your Facebook pages or anything else. We're not going to leave you though with high and dry here. As you saw earlier, NYSOFA has a video about MSP that featured Heather, but we also have resources to help spread the word about the website that we have where you can get assistance. So please look in the features section, and there is the website information right there to find more information, including social media toolkits and ways that you can spread the word as well. I thank you all for joining. And again, for Heather and Fred, thank you so much. This is such an important new program or expansion. I want to thank the governor and the legislature again, but the two of you, this is your third time on. We got to keep doing this. We have a long way to go to get several 100,000 more people, plus all of those who are eligible but didn't know about it prior, to really receive this important benefit. So thanks for joining us. As always, I thank Roger Noyes and Alex Hyatt for putting this production together. It's really spectacular, and we'll see you in a couple of weeks. Thanks for joining us.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please make sure to join us next time.